When I came from Afghanistan 12 years ago, I felt lost, like I was between two worlds. At first, I didn't know how to do anything, but now I have a college degree, a job, and a car. My cousin Mastura and her husband Kamal must have similar feelings. They came here as refugees from Afghanistan only 8 months ago. Mastura has terrible asthma, and the doctor has called for a conference to discuss her treatment plan.
Mr. and Mrs. Ramadi, we're ready for you.
Thank you for coming in, Mr. and Mrs. Ramadi. I believe you've met everyone here. Our pharmacist, Ray Toyi, our nurse, Alma Ford, and I'm Dr. Jane Howard.
Please have a seat.
I wanted to get us all together today to review your treatment plan, Mrs. Ramadi, and see if we can improve on your care. I'd like to begin by saying that we're a little concerned that the medicine you're currently taking for your asthma condition might not be the best medication for you.
This is the medicine that I give to my wife for many years.
I understand. And I know that at your last visit, we agreed to continue with this medicine. But since you're somewhat new to our clinic, could you tell us when Mrs. Ramadi first started taking theophylline?
There is not enough medicine for people in Afghanistan. We had to travel from our village to get this medicine. I was a government official, so people would listen to me. This is how my wife was able to get this excellent medicine.
I see.
Now, we also noticed that Mrs. Ramati had her prescription refilled twice in the same week. We mentioned this only because we want to make sure she's taking the right amount of medicine.
She is taking the right amount.
Mrs. Ramadi, your blood levels today indicate a low level of theophylline, so we're concerned that the medication might not be working as well as it should.
No, it is working.
Mr. Ramadi, do you feel that the medicine is working today?
It always works when my wife takes it.
When she takes it?
Mrs. Ramadi, when did you last take your medication?
The day before the yesterday, I think.
But not yesterday or today. I don't understand.
Because I come to see you, doctor.
Do you always stop taking your medication before your doctor's visits?
Yes, I must.
But the prescription says you should be taking it every day. We talked about this at your last visit, and I thought that you understood. Why do you stop?
There are not so many doctors in our part of Afghanistan. Only the very sick can be seen. If you come to the clinic, you're not so very sick, they will not see you. They will not give you the medicine. You must show them that you are very, very sick in order to get treatment and medicine. This is what you must do with the doctors.
I think I'm beginning to understand.
Another pharmacy says we can't have more refills. I don't understand this.
Let me try to explain about the refills. Patients who are new to our clinic are only allowed 2 refills because we need to assess how the medication is working.
And here at our clinic, you don't have to look sick in order to get medical attention.
Yes. We treat you no matter how you appear when you arrive at your visit.
What is it that you write in there?
This is Mrs. Ramadi's medical records. This is where we keep track of all medications and whether or not they are working.
Is the government keeping track of this?
Only the people involved in your health care see this.
Mrs. Ramati, have you been trying to keep some extra medicines from the pharmacy at home in case you needed it?
Yes, a little.
I think I understand now. But you should know that sometimes medicines can stop working after they sit around for a while. And we want to make sure that you're taking only fresh and strong medicine so that they work really well.
Mr. and Mrs. Ramadi, This medication has been working well for you for many years, so I think we should continue with it for now. But I also see from your pharmacy record that you haven't picked up your new medicine, the inhaler that we talked about at your last visit.
I still need to know more about this inhaler medicine.
Certainly. We can discuss all your concerns about it today, because I feel that Mrs. Ramadi might benefit from adding this inhaler to her treatment plan. It has helped many people with asthma.
But no medicine can cure her sadness and loneliness, I'm afraid. We miss our country. We miss visiting with our friends and family. And we can't find out if they're still alive. Sadness is a true sickness for Afghans, Doctor.
I'm sorry for your sadness. It's certainly understandable. All your worries and concerns.
Mr. and Mrs. Ramati, I too come from another country to the United States. I'm from Laos. And when my family arrived here as refugees,
Mastura and Kamal seemed a little happier when they came out of the conference. I can't wait to get home, visit, and hear all about it over some hot tea. I like seeing their sadness and pain go away for a few hours. A few hours less of feeling like you're between two worlds.